reduce that number significantly.
Okay, and you also talked about lack of efficiency in the government. Could you explain that?
Yeah, do you know exactly where that?
That was just like a quick tag for me, right? You just said something about the lack of efficiency.
Oh, and that was a disadvantage. Here, I'll grab that. Well, I can just talk about it. So the lack of efficiency was referring to how governments are throwing away money, and like the fact that the federal government is running these certain programs rather than community organizations or at state level, they're just throwing away their money because they're not able to do enough.
Okay. All right, Angela, do you want some prep time? Okay.
Okay. Can I just, I'll take like a minute.
I'll just tell you in 30 seconds. How are we doing flow-wise?
Pretty good.
On the flow chart,
Yeah.
where would you put the notes for the clash? I mean, not for the clash, for
The DISED,
the
Kemplin.
what one that you just did right now.
Oh, the social workers, I put it on, oh, you mean the cross-examination?
Yeah, yeah,
You
yeah.
don't flow that.
Well, if I'm taking notes on it,
You don't write it down. Yeah. It's, only things that count, you've used 45 seconds, are the things that are said in speeches. So like as a judge, you're not really supposed to consider what's said in class ethics. It's more of an ethos thing.
I should put the clash.
Yep, that's good. All right, used a minute.
Okay.
I might have to delay for a second, my pen is dying. Oh, there it is. Okay.
Just go whenever. Okay, so I first want to address his issue with, well, his plan to raise minimum age. Homelessness increases the severity of any health issue. Pickett, who's a medical doctor, simply being homeless exacerbates health problems. As the National Healthcare for Homeless Council points out, living on the street means greater exposure to harsh weather, violence, and malnutrition. Without a stable place to stay, it is difficult to store medications that must be taken daily, keep wounds clean, and get proper testing. High stress and dangerous environments worsens psychiatric problems and leads to increased substance use. So raising the minimum wage doesn't really help homeless people fix all these issues as they're not getting paid. I also want to, he talks about diseases and fixing that first before fixing environmental needs and just basic needs. Homelessness has a bigger effect on health than heart, lung, and other diseases. Pickett, who's a medical doctor. The impact of homelessness on health and functioning is enormous. Compared with health individuals, people experiencing homelessness have a higher rates of heart, liver, and kidney disease, diabetes, HIV/AIDS, hepatitis C, tuberculosis, cancer, and etc. Also, he talks a lot about cost, and he talked about social workers and how that's an issue. There's not enough of them. Similar models to Health Leads volunteer program will cut cost of healthcare while still addressing healthcare problems. Having volunteer students work in partnership with providers on these complex social issues may be one potential solution to large urban pediatric practices. We believe that the HL model has an innovative, time-efficient, and effective system of care to address families' social problems at well child care visits. And that was by, Garg, who's a MD, Moreno, who's also an MD. And another thing to address this cost issue is study results show which patients need help the most. So overall, a total of 2,265 family needs were identified during the study. Each family had a mean of 2.1 needs. The most prevalent needs were unemployment, which took up 25%, housing, which took 14%, childcare, which took 13%, and then health insurance, which was 11%, and food coming behind that for 10%. So taking all that into consideration, this is the reason why we need to fix this problem, and fixing all those needs is much more important than even getting insurance, because there's just a more demand for those, for a solution for those problems than as the numbers showed. And healthcare was only, healthcare and health insurance was only 11%, which was compared to employment and housing, which were a much higher rate. Also, another benefit to this plan, doctors who build strong and long-term relationships with patients have a better chance of getting to the root of the patient's environmental needs. So pediatricians have the opportunity to address patients' social needs given their unique longitudinal relationship with families. This is especially true in the first 3 years of life when child care visits are frequent. It is particularly important then since the effects of poverty are more deleterious during this sensitive time. And this was by Gard, who's an MD, Marino, who's also an MD. So having doctors fix these issues, especially at a time where a child is developing, is much more important and beneficial, as later on, if they don't get these issues fixed, they'll come back in having all these medical needs. So this actually in turn cuts costs, because you're fixing the issue when they're very young, instead of waiting for them to get a bit older and not have these basic needs, which creates a bigger problem in retrospect. Also, oh yes, the Health Leads model is proven to address the social needs of patients and improve health. The HL model integrates primary care with existing public health infrastructure, for example, community-based resources, and may promote greater health equity by addressing the unmet basic needs that low-income families disproportionately face. So this actually does integrate well with community health care and community things that are set up. And another proof that this actually works, results show improvements in families after addressing their social needs. Pickett, who's an MD, and Luther, who's an MD, says that in this program, evaluation, with the Health Leads program, by the way, we found that Health Leads model had a positive impact on reducing unmet social needs for low-income families. And also when he addressed homelessness and people who actually have jobs, I wanted to go back to this point because people that are homeless don't have access to basically nothing. They have access to basically nothing. So this is another harm and significance. Homeless people have a hard time getting health care, while other needs are similarly as important. Getting and staying connected to healthcare is extremely challenging for people experiencing homelessness. Meeting basic needs, finding food and a safe place to sleep are often greater priority than getting treatment for a health problem, which makes the health problem even bigger.
Okay. Chris, you want to use the rest of your prep time?
Yes, please.
How we doing flowing waters?
Pretty well.
Good. Are we all on one paper, or do you have 2 papers?
That's two.
You have 2?
Yeah,
Okay,
two.
good. You only have 1 though.
What?
You have 2 papers or 1 paper?
I have one.
Okay, so you put the off case and the on case on the same paper.
Oh.
So you want to
You
keep
want me to
them?
pass it on to the machine?
No, it's okay.
I do this.
But it would just make it harder for you to track
And then you do
across.
3 things.
Oh.
Yeah, that's right.
Yeah, so I have to do the whole thing right now, correct?
All the,
Yeah. Am I allowed to say my speech at the end? Like the why?
It's good to do it at the beginning and the end. So you have a 1:30 remaining still. 1 minute. Thirty seconds. Five seconds. Done. Not long enough for Colin to check his email.
Okay, so why I believe I won this is that my disadvantage showed the deficit spending that would occur if this plan were put in place, as the government is not allocating its funds in the right areas, as it'd be more beneficial to put it in local community or states. And then also the large majority that my counter plan addresses is that what my counter plan addresses in that large majority of Americans who are employed are in poverty, and this will be, my counter plan will be beneficial to them. And my opponent's strongest argument is about homelessness and how this wouldn't affect them necessarily. But and then why I think I still won is that a majority of Americans who do have a job are still in poverty or under the poverty line, and the minimum wage would help them get out of poverty and be able to have access to this extra care. And we can't just like forget about them. They're still part of it. So I'd like to reiterate about my disadvantage. So once again, I'm going to state the thesis. Healthcare practitioners working more directly with social workers to provide basic needs to people with health problems that may be rooted in these stresses of poverty will have deficit spending from the government, as there has to be a trade-off between this. And the uniqueness in Brink, as I said earlier, right now there is no spending that is needed on poverty as the government. Other organizations already do this, and many people who are in poverty are well taken care of by these organizations. And the lesson, so according to the Washington Post 2015, so the U.S. deficit spending is less than predicted. And the data that the Washington Post has is that over $455 billion in the budget deficit this year, or the federal government is on course to record $455 billion budget deficit this year, which is $128 billion less than the Obama administration had projected 6 months ago. And this is the 0.6% of the GDP that we're planning to borrow this year. And the link for this, the plan will cause deficit spending. The evidence for this deficit spending would occur as a result of a federal program that would be initiated by this, my opponent's affirmative plan. And under Kaiser Family Foundation 2012, the challenge is made more difficult by the highly decentralized nature of healthcare decision-making in the United States. And healthcare investment and spending are influenced by federal and state programs with differing payment systems, incentives, and reimbursement levels. And still, the lack of coordination across public and private spending programs makes coordinating efforts to reduce costs and increasing efficiency systems a challenging proposition. And the internal link, government intervention and trade-offs because of debt hurts other future endeavors that the government could pursue rather than putting their money in this. And it would be able to help others in need. And the evidence, so deficit spending causes the government to throw away money in Johnson 2013. For the past 2 generations, and particularly like the last 12 years, Washington has begun to pile up massive and unsustainable levels of debt. And one major consequence of this huge accumulation of debt has been the harm is it is causing America's economy to come out of control. And like I said earlier, the current debt stands at over $18 trillion now. And before Washington can pursue anything else, they need to first pay off their interest of debts to the people and the nations that they have lent money to us. And the impact of this disadvantage, the government will lose money and time that it could have been used to create more hospitals and provide treatment to people in poverty with serious illnesses causing many to die. The evidence, the lack of efficiency in the government will lead to loss of money and lack of innovation. Under Mitchell 2005, government spending is a less effective way to deliver services. Governments directly provide many services and activities such as education, airports, and post operations. However, there is evidence that the private sector should provide these important services at a higher quality and lower cost. The government spending also hinders innovation. And reducing government or developing federal programs to the state and local levels can eliminate or mitigate this effect. And then once again, I'll go over my counter plan. And the counter plan I was addressing is how the minimum wage increase would affect millions of Americans who are under the poverty line and who are employed. The plan, the U.S. federal government should pass legislation that would increase the minimum wage. The legislation should focus on raising it to a certain level that is acceptable for the cost of living today. This has been determined by the inflation rate. The funding will come from the general federal revenue to jumpstart it. Businesses and corporations will be required to accommodate for the change by 2020, and it will be enforced by the U.S. Department of Labor under the Fair Labor Standards Act and its Wage and Hour Division. And raising the minimum wage, under my solvency, raising the minimum wage would eliminate reliance on assistance programs. So there would be no need for any additional assistance programs. And raising the minimum wage to $10.10 an hour would reduce government expenditures on current income support programs by $7.6 billion per year, and possibly more given the conservative nature of this estimate. And workers in the bottom 20% of wage earners receive over $45 billion in government assistance each year from the 6 primary means. And the minimum wage is raised to $10.10. More than 1.7 million Americans, workers, would no longer rely on public assistance programs. And raising the minimum wage allows for more spending power of the lower class under Cooper 2012. The immediate effects and benefits of a minimum wage increase are on the boosted earnings of the lowest paid workers, but its positive effects would far exceed this extra income.
So Angela, you have 3 minutes of time left. Oh, you have 3 minutes of prep time if you want.
Oh, okay. Okay. Yeah, my phone died, so I'll leave your time.
Oh, okay.
I can keep one.
Okay.
How we doing? Colin, how many times do I have to shame you about these emails?
They just keep coming.
Well, they'll wait.
Yeah, put it away once I start talking.
I had that idea in my head. There was something that you said, but.
Yeah, I'm sitting here thinking of my own strategy right
Good.
now.
Yeah.
Good,
What I do.
good. You have 2 minutes left, Angela.
Okay.
That's what you should be doing instead of checking emails.
I was doing both. I was practicing my multitasking for the day.
Yeah. Studies say that people can't actually multitask.
But I say.
There you go. That's the spirit. That's the spirit. So next week,
Oh, yeah.
it's gonna be, oh, wait, Eduardo, I don't wanna distract you.
Yeah, I got
Okay. Next week, dress professionally.
Okay.
You're gonna have professors and a nun. I got a nun to judge.
Okay. Is that like a dress shirt, or do you want like full-on sport coat?
I'll leave it up to you. It might be warmer if you have a sport coat on. It might be cold by this time next week. Unlike our fall, balmy weather here in Minnesota.
Yeah. It's great.
Hey, I'm not complaining.
Exactly. They're gonna come in here.
Do you think they will?
I think so. I think it's a
Oh
possibility.
no. You're in charge of running after them.
Just yell, hey, no.
30
Get out.
seconds.
And I have 3 minutes in total to talk, right?
That's correct.
Oh, thank you.
Mhm.
Okay.
Okay, so in this debate, I think that I win because this plan that, his plan to cut, the negatives plan to cut costs, doesn't really, my plan actually addresses that. His counter plan to raise minimum wage isn't effective for those that are not in the job field. Some good points that he did bring up though was that the majority of people are employed, but however, there are people that are employed that still can't afford to put food on the dinner table or can't afford to buy clothes for themselves. And some, in my opinion, my personal experience, can't even afford an insurance plan. So that doesn't solve anything. And that's why I think I still win, because we haven't forgotten about the people that are employed. We are just concerned with homeless people, children, and just anyone else who want to fix the root of their problems. It's not that we've forgotten about them. And also raising the minimum wage comes with a lot of cons, and that actually isn't going to fix the deficit, it's only going to raise it and hurt the private sector. So it's just that comes with a lot of extra cons that we don't even want to deal with at this moment. The unemployment rate is very, very high, and I just, that's forgetting about those people instead, and that his plan just doesn't solve it. And also, we won't create a lot more hospitals, as he's saying. It's just making sure that these doctors